Okay, great. Well, I want to welcome everyone. Thank you for signing on a Saturday afternoon. We are really lucky to have Sean Miskell with us here today. So I'll tell you a little bit about Sean's background, and then I'm going to turn it over to him to talk to us for a little while, and then we'll also have time for questions, okay? So Sean Miskell is a health policy analyst at the Government Accountability Office and a PhD candidate in political science at Syracuse University, my alma mater. His research focuses on health policy and politics in the United States, particularly regarding Medicaid, the Affordable Care Act, and drug policy. So prior to joining the GAO, Sean was a research fellow at the Georgetown University Health Policy Institute. Sean holds an MPA from Cornell University and a BA from Lemoyne College. He lives in Washington, D.C. with his wife and 2 children. And today, as you can see, he's going to be talking to us about GAO oversight of health policy legislation, the ACA, and the CARES Act. So Sean, thank you for being here, and please take it away.
Awesome, thanks. And let me know if you can hear me okay. I guess got a message that my internet connection is unstable.
I can hear you.
Awesome. All right, well, thanks very much. And like Professor Boscarino said, I really appreciate people turning out on a Saturday afternoon. I'm going to mostly talk about my experience working in health policy at the Government Accountability Office, but my research interests are in like my academic life are pretty similar, focused on Affordable Care Act, Medicaid, health reform. So they dovetail quite a bit. So when Professor Boscarino asked me to participate in this, I thought a bit about what I wanted to talk about, because talking about specific GAO reports I've worked on can get pretty wonky pretty quickly for some reasons I'll talk about in terms of the way we do our work. So I use this as an opportunity to kind of step back and think about GAO, how GAO does its work in sort of a broader context, kind of like where we operate in the sort of like policy information ecosystem in Washington, D.C., and also think about the work we've done on health policy, specifically the Affordable Care Act, in a sort of big picture way. So what I did was I went back for the past 10 years or so. I looked at all the reports we've done on the ACA, tried to identify some sort of, different themes for periods of time and kind of how we were looking at it. I spoke with some directors and some other folks at GAO about, sort of their takes on that work. And so I'm going to try to talk about that in a kind of big picture sense. And then at the end, I'll also talk about some of our more recent work on the CARES Act, which is the COVID-19 relief / stimulus. I won't have as much to say about that. It's pretty new, but it's also pretty timely. So I thought I would at least touch on it. And then really happy to answer any questions or have a discussion at the end. At the outset, I just got to say, I mean, this is sort of silly, but I feel compelled to note that I'm speaking only for myself, not as a representative of the GAO. We have people who speak on our behalf. No, I'm not one of them. And so, these opinions are my own. Okay, so a little bit of background on GAO. So we're an independent, nonpartisan agency. We work for Congress, where our funding comes from Congress's funding for itself. So when Congress is deciding like how much their members are going to get paid, how much they're going to spend on, the Capitol building or other congressional buildings, we are sort of like rolled into that budget. Which is, I think, worth noting because, we're supposed to be independent of Congress, but, they could decide tomorrow to get rid of us and not fund us anymore. So independent only to the extent that they want to keep us around and, keep paying us to do policy analysis. And I'll talk a little bit more about that later. In general, we focus on how federal funding is spent and how executive branch agencies are implementing laws passed by Congress. According to our website, we generate about $138 for every dollar invested in us. We've been around since 1921, so we're coming up on our 100th year, but we haven't been doing the same work the whole time. From when we were founded after World War I, when the nation's finances were in a bit of disarray, through about World War II, we really just focused on federal spending. For a very long time until recently, we were actually called the General Accounting Office, and we were only changed to the Government Accountability Office in 2004. In around 1974, well, after World War II, we started, doing more work on government programs as the federal government was expanding, implementing New Deal programs, just expanding in general. In 1974, Congress passed legislation that sort of broadened our role. As a result, we hired more subject matter experts, scientists, economists, that sort of thing. The head of GAO is the Comptroller General of the United States. The Comptroller General is appointed by the President, approved by the Senate. And we've only had 7 in our entire 100-year history. Recently, under our previous Comptroller General, he made some changes to GAO that sort of try to make us more like management consultants in terms of how we approach our work, how we're organized. We have, managing directors, similar jobs and titles that you'd see in like a private consulting firm. We refer to Congress as our clients now, which is a little silly. As a result of some of those changes, GAO analysts formed a union for the first time, so we are part of a public sector union at GAO. Here's a list of the mission teams at GAO. I won't run down the list, but I kind of want to give a sense of the sort of broad nature of the work we do. I'm on the healthcare team, but we have teams that focus on, the Department of Defense. We have teams that focus on education, workforce, and income security issues. Teams that focus on physical infrastructure, natural resources, and the environment. Strategic issues generally refers to taxes or government-wide issues. And then the newest team at GAO is the Science, Technology, Assessment, and Analytics team. So the way we organize ourselves into subject areas kind of changed over time, and is consistently changing. Like I said, the Science, Technology, Assessment, and Analytics team is only about 1.5 years old. So, we're organized by subject matter, and that sort of changes as like the sort of policy environment changes. In terms of GAO personnel, as I sort of hinted at before, we have both generalists and specialists. If you're hired at the GAO, you're probably hired as a quote unquote generalist. Entry-level employees at GAO are in what we call a professional development program, where you rotate around to different mission teams and kind of get a sense of the work we do in different areas before you kind of land on a sort of quote unquote permanent mission team. So I rotated through the education, workforce, and income security team, and the physical infrastructure team, as well as the healthcare team. And here I am on the healthcare team. But we also hire people with specific areas of expertise. So people with, areas of expertise in infectious diseases, or, people who are economists, or, labor attorneys, all kinds of things. So you could, either be a person at GAO who works on all different topic areas, or, someone who's hired to do something very specific. So in terms of what we do, the bulk of what we do is publish reports. And most 85% of the reports that we publish come from requests from Congress. And it's usually at the level of a committee chairman or a ranking member. Just given the nature of our workforce and how many requests we get from Congress, we can't take all the requests that we get. And so we're much more likely to gravitate towards things that are, come from committee chairs, and especially things that are bipartisan. for reasons I'll discuss a little bit later, we really try to be useful to both parties, both because of our sort of nonpartisan identity and because, like I said, we get our funding from Congress, so it's important to us to, respond to requests from both parties and do work from both parties, regardless of, who might control the House or the Senate. However, we also have other sources of the reports that we do. One could be mandates. So, Congress could pass a law, and within that law, there could be a mandate that GAO do a report on how that law is being implemented. So I've done some of that work as well that I'll talk about. And we also can initiate a report under what's called Comptroller General Authority. So basically the head of GAO can just decide like, hey, we're gonna write a report on this area, which we sort of thing we do pretty often. It's usually on a broad topic, right? So a recent report we put out under Comptroller General Authority was like on the state of retirement in the United States. We'll do other reports on, the budget deficit or that sort of thing. So things that are sort of broad, cross-cutting, much broader than a kind of request we might get from Congress on a specific program. We also testify before Congress pretty regularly. I think at least once a week, someone from GAO is testifying before Congress, often regarding reports we've issued, but we'll also testify as experts on a specific topic if Congress is considering legislation. We also do technical assistance for Congress. So what I mean by this is, responding to requests from Congress that don't result in public reports. So, it might be a follow-up on a report we've done, additional data analysis, more updated data, or, a more targeted question that a member of Congress or a senator might have that isn't enough for a full report, or something that they want to get more quickly than it takes us to do a full report. So we'll do that as well. Our Office of General Counsel also publishes legal opinions at the request of Congress. A few of them have been in the news recently. So for example, it was earlier, or I guess last year, a member of Congress requested that we submit a legal determination regarding whether it was legal for the Trump administration to halt aid to Ukraine, right? Which, as we all know, resulted in the impeachment of the president. And our Office of General Counsel determined that the Trump administration broke the law in halting the aid to Ukraine because they didn't, do it the way you're supposed to, following the appropriations process, for money that was appropriated by Congress. And, this was, generally a lot of news, such as it is these days when, something big could happen and it's in the news cycle for a day. But, it was like on the front page of the Washington Post. More recently, we issued a legal opinion regarding the appointments of acting Department of Homeland Security Secretary Chad Wolf and acting Customs and Border Patrol Secretary Ken Cuccinelli. GAO determined that their appointments were not made legally, so they could not legally be in their positions. And I think those two things are worth noting, both because they're recent, they were in the news, but also because I think, I was surprised to see both those rulings because, and again, I'll talk a little bit more about our process shortly, but as we're writing reports, there's a lot of levels of review they have to go through, and one of those levels is, our Office of General Counsel reads all reports, make sure we're characterizing laws accurately and, reporting things that are consistent with the law. And, my experience with them is they're often kind of like a wet blanket. We have these things we want to say, and then we get the review back from our Office of General Counsel, and it's like, oh, don't say that, or like say this other thing less strongly, and kind of like generally watering things down. So if our Office of General Counsel generates a legal opinion that's gonna like make the administration angry, it's gonna be on the front page of the Washington Post, like that is super illegal. Like we would not go out on a limb, like if it's like a gray area judgment call. Like if you see our Office of General Counsel like making a legal determination that like generates news, like it is a blatant violation of the law. And I'm not a lawyer, so I can't really speak to the process by which they do things, but it was interesting to me when we made those when we published those legal opinions, because they don't take that responsibility lightly. We also make appointments to healthcare advisory committees. For example, the Medicaid Payment and Access Commission. And we also play a role as the supreme audit institution of the country. And that has means a few different things. So our agency is a sort of authoritative source for auditing standards of government agencies. Any executive branch agency has its own Office of the Inspector General that is like the internal watchdog for that agency, and they use GAO processes to conduct that work. We also coordinate with our sort of peer institutions in other countries, and we do peer reviews of one another. So every couple of years, members of the equivalent of GAO in other countries, that country's supreme audit institution, will come and they'll take a random selection of our reports, review them, review our processes, and kind of we report on each other in that way. So it's which I think is really interesting. Our reports can include a few different kinds of things. Certainly descriptive information. So for example, if we're reporting on the Affordable Care Act, we might report, on how much, how the level of number of people who are uninsured changes from year to year, the kinds of services people are using, sort of descriptive, information that comes from, interviews we do, data we analyze, that sort of thing. And I think, we can provide a lot of value in that regard because we have access to a lot of information that, other kinds of researchers might not have. When I'm doing work as, an academic scholar, trying to publish a paper in an academic journal, I might, call people or email people hoping for interviews or, trying to get data, and, fingers crossed that they're going to email me back and help me out. Where if I email someone in my role as an analyst at GAO, like those calls get returned, my emails get returned. Agencies have to give us the data we ask for. They have to let us interview them. They have to give us documents for requests. So we have a lot of access to a lot of information that others do not. And we also have, I think on the one hand, I think typical federal agencies, we have our budgets are strapped. We're always trying to do more with less, but we also have a lot of resources relative to other researchers who might be relying on grants or their institution. So we can spend a lot more time and invest a lot more resources into answering questions, obtaining information than others might be able to. In our reports, we also issue recommendations to executive agencies that they have to follow up on. I don't think there's much penalty if they don't. We can't like deprive them of funding, but technically, if we say, as a result of our report, we say an agency has to do something, they're supposed to do it. We can also issue what are called matters for congressional consideration, which is similar to a recommendation from an agency, but it would be for, if it's something that would require legislation for an agency to do that the agency can't just do itself. And to do either one of those things, if we're going to make a recommendation or make a matter for congressional consideration, we have to have all four what we call elements of a finding. So we have to be able to describe the condition of something, what is, what we found, the criteria, is there a law that says it should be a different way? Is there agency regulations? what is the cause of the issue and what is the effect. And so my point in sort of describing all that is to say that, we can't, if we make a recommendation to an agency or suggest a matter for congressional consideration, it has to meet pretty strict criteria within the agency for us to be able to publish that. We can't just, it's not just like an opinion of the analyst that worked on a particular report. There's sort of a very formal process by which we decide we're going to recommend something to either an executive agency or to Congress. Let's talk a bit about the process by which we will write a report. The first step is called acceptance. Like I said, we can't report on every request we get from Congress. So, we have to formally accept a request from Congress to start working on it. After that, we would, kind of staff that. The way it works is, the team that I'm working with at GAO right now is very much based on the report I'm working on right now. Once I publish the report I'm working on right now, which will probably be like February, March, I will be up for staffing, and once a month the agency looks at what requests we have from Congress, what personnel we have available, and matches people up to different reports. So the team you're working with and the topic you're working on changes every time you publish a new report and move on to something else. We have an initiation meeting where we kind of gather all the people that are going to be involved in writing a report. So usually the team that actually writes the report is usually pretty small, three to five people. But then we have what we call within GAO stakeholders that sort of review the report and provide guidance. So our Office of General Counsel would always be a stakeholder, and then we might have additional stakeholders depending on the nature of the topic. So, there might be an aspect of healthcare that touches on education issues. So we'd have someone from the education team kind of be a stakeholder and help guide the report. We might be doing something that involves sophisticated statistical analysis. So we might have someone from our methodology team as a stakeholder on the report. So again, that sort of thing changes based on what we're studying. We work on the research design, again, have another meeting with all those people to discuss what the team thinks the research design should be, what methodology is appropriate, both in terms of what the topic is the methodology appropriate for the questions we're asking, but also, different methodologies have different trade-offs in terms of how long they'll take, how much it will cost, and, depending on the nature of the request, certain requests we might decide yep, this is really important. We have to, do a certain kind of analysis regardless of, how long it takes or how much staff we need. And other things we might decide either because it's, a lower level issue and something we want to try to get out more quickly, or if there is a pressing need, say a law is expiring at a certain point and Congress wants information before that happens, we might change our methodology to, get Congress information more quickly. Generally, reports take 10 months to a year to complete. It could be up to 2 years, it could be 6 months, but it's usually about a year, a little less. So, we might change the methodology if we want to do something more quickly. Then we move into evidence gathering and analysis. Like I said, this, we do a lot of interviews. We have to, what we call enter with agencies that are involved in the programs we're looking at. So we have, some what we call formal entrance conferences where we meet with people from the agency, and then we usually follow up them as we're doing the work. Either, having interviews, requesting documents, requesting data. We also interview external organizations and experts, and analyze all that information. We draft the report and go through a process of what we call message development and agreement, which is basically like the outline of our report. We kind of get agreement on that before we kind of sit down to formally write it. And the reason we do that is, we generally don't have, when we're organizing a report, our section headings and that sort of thing are usually message oriented, talking about, what our conclusions are. So we kind of like get agreement across all stakeholders within the agency for kind of like what our main takeaways are going to be before we kind of fill in the details through writing. One of the last steps is a step called indexing and referencing. When you've written papers for classes, or if you're a scholar, publishing articles, obviously you have to cite your sources. You'll have a reference section, you'll have footnotes, that sort of thing. For a GAO report, after we finish the draft, the team that wrote it goes through a process called indexing, where we go sentence by sentence and provide the support for that sentence. And if it is something someone told us, we have to attribute it to whoever told us that. If it's a GAO conclusion based on data we analyzed, or a bunch of interviews we did or something, we have to say that, and then we write like what we call a work paper or a record of analysis, kind of documenting how we came to that conclusion. It takes an insane amount of time, frankly, and it's a process that I've like developed grudging respect for. I've spent like literally hours, indexing footnotes, and so my point in saying that is not only to kind of describe the process, because I think it's kind of interesting and different from other kinds of research and kinds of publications, but if you're reading a GAO report, that information is close to unimpeachable, because it has to go through such a process, and it's hard to get anything out there. And I'll talk about some examples later, but if we say anything that's like close to hard hitting, we have to meet a high bar to be able to do that. And then after we're finished, we send our draft to the agencies that we've been working with that are involved, and before we release it publicly, they comment, and they also provide us with sort of a technical review to kind of make sure we didn't get anything wrong, or if something has changed and there's updates, they help us out with that, and and we publish the comments they send us. So we'll publish what they told us, if they agreed, disagreed, what they thought of our recommendations. And sometimes it's like, Department of Health and Human Services agreed with GAO's recommendations, and we'll do it. And sometimes it's like, Department of Health and Human Services didn't agree with GAO, here's why. So that is, it's not a formality. There really is like a back and forth. And then we publish the report. We generally publish our reports a month after we release it to Congress, unless the members of Congress that request the report say we can publish it earlier. So next, I want to talk a bit about sort of like where GAO kind of sits in sort of the broader information ecosystem in Washington, D.C. So we are a congressional support agency. Like I said, we're funded by Congress. And we're not the only one. There's also the Congressional Research Service, which is part of the Library of Congress. And they do definitely very similar work. It's actually very often the case that when we get a request from Congress, they've also made the same request to the Congressional Research Service, like word for word. So they'll often kind of like, I don't know, hedge their bets, but ask different supporting agencies the same question. But the Congressional Research Service is a little different in that they generally are a shorter term, they'll answer questions from Congress on a much shorter term, like often getting back to Congress like, the same day or the same week. And if you've ever seen a report by CRS, that's actually not generally what they do. They spend most of their time answering questions from Congress, and if they publish a report on a topic, it's almost something that like the analysts there do in their free time. They're much more sort of like I said, it takes us a year to write a report, and if you want an answer quicker, you probably go to the Congressional Research Service because they'll get back to you sooner. And there's also the Congressional Budget Office, which provides Congress with information about economic analysis or budgetary analysis. So if Congress is going to pass a bill, they will go to the CBO to find out how much it will cost. And then there are also executive branch audit agencies. So like I mentioned before, each agency has its own office of inspector general. But again, those that do similar work to GAO, and whenever we're starting an engagement, early in the process, we'll reach out to CBO, we'll reach out to Congressional Research Service, we'll reach out to the relevant offices of Inspector General to see, have you done research on this recently? We don't want to, like I said, Congress might ask us the same question and we just both have to do it, but to the extent we can overlap, can avoid, doing the exact same work, we'll try to if we can coordinate. So, all these agencies are distinct, all of them, except for the Inspectors General, work for Congress, but do their work in a slightly different way. In the mid-90s, when Newt Gingrich and the Republicans took control of the House of Representatives for the first time in 40 years, Speaker Gingrich, not a fan of these independent congressional support agencies, kind of cut funding across the board for all of them. In some cases, like the Offices of Technology Assessment, eliminated them entirely. And for GAO, CRS, and the congressional professional staff, so the analysts that work for the House Budget Committee or whatever, all those got cut by about a third across the board. So I think I think GAO laid off about 40% of the agency at the time. I didn't mention at the beginning, I meant to, we have, I work at our headquarters in Washington, D.C., where most employees work. We also have 11 field offices around the country. And we used to have field offices all over the world, and a lot of those got closed. Other field offices got closed. So in the 90s, the agency and similar congressional support agencies took a big hit that we haven't fully recovered from. So this is some published by the Brookings Institution that kind of tracks congressional support agency funding and resources. The GAO would fall in this dark blue line at the bottom, and the House and Senate support agencies are the other two lines, documenting that the number of staff has either been slightly declining or stagnating over the past few decades, at a time where, of course, the government is only getting more complicated, increasing number of programs, increasing number of cabinet level agencies, et cetera. So doing more with less. And I think that has implications for, what I've talked about is sort of the information ecosystem for policymaking and congressional independence. Because if, in-house congressional support agencies have less resources, Congress has one of two options. They can either make less informed decisions, which is probably happening, or they can go get their information from other sources, which, not that there's necessarily anything wrong with that. Often that might be think tanks, academic researchers, but it's also probably, very likely lobbyists. And, I think you're going to get a different kind of information from a lobbyist that's representing certain interests, or a think tank. I've worked for think tanks. I think they do really good work, but well, I think that the work that think tanks do is generally robust. I think most have the sort of ideological or policy orientation, and I think that affects the kind of work that they choose to do, the questions they choose to ask, right? So I worked for I guess, quasi-liberalish health policy think tank, and we did a lot of reports on how the Affordable Care Act, increased health coverage, decreased costs, et cetera. If I worked for a conservative think tank, we would probably not do that kind of work. We'd probably do more work about Medicaid program integrity or waste, fraud, and abuse in these programs. And again, like, all that work could be methodologically sound and rigorous, but different organizations choose the kinds of questions they ask and how they do the work, whereas institutions like GAO are sort of constitutively nonpartisan and just talk about things in a different way. So next, I want to move on to talking about our work on the Affordable Care Act. Like I said at the beginning, I thought this was a good opportunity to kind of try to look at GAO and our work in this area in a big picture way, as opposed to talking in detail about the reports I've worked on. First, I'll talk a little. I'm sure we're all familiar with it to a certain degree, but I'll talk a bit about what the Patient Protection and Affordable Care Act does. One of the biggest problems I have with GAO is that instead of calling it the Affordable Care Act or Obamacare, like everyone else on the planet, we always call it the Patient Protection and Affordable Care Act, or PPACA. I find it very frustrating. But in an effort to expand health coverage and reduce the costs of health coverage, the Affordable Care Act did a few core things. One is the now removed individual mandates, so this requirement that everyone purchase insurance, and concomitant with that requirement was guarantee that you hear about this discussed in the context of pre-existing conditions, but that if insurance companies can't deny anyone coverage that applies, as long as you pay your premiums, you are entitled to coverage from a company, whereas prior to the Affordable Care Act, insurance companies were much more involved in sort of structuring their risk pools and trying to keep high-cost patients with pre-existing conditions out. So under the Affordable Care Act, individuals have to buy insurance, and companies had to offer it, provide it to you. And also companies had to meet certain coverage requirements. So there are certain things that all insurance companies had to cover in the Affordable Care Act, whereas prior to that, it was not the case. The Affordable Care Act also created health insurance marketplaces, which are basically websites where people can shop for insurance, and provided people up to a certain income level with subsidies to purchase that insurance. So you often will hear those things described as a three-legged stool. So individuals have to buy it, companies have to give it to you, they have to cover certain things, and we will help you, the government will help you afford it based on your income. And finally, part of the Affordable Care Act was an expansion of the Medicaid program, whereas prior to the Affordable Care Act, states varied quite a bit in terms of Medicaid eligibility requirements. Some states had very low requirements where you had to be very, very poor to qualify for Medicaid, whereas other states were more quote unquote generous with Medicaid coverage. And what the Affordable Care Act sought to do was kind of raise the sort of income eligibility threshold for Medicaid so more people would be covered by it. And also it made it so anyone could have Medicaid, whereas before many states, you had to either be a dependent or have dependents. In a lot of states, Medicaid was not available for able-bodied adults. You either had to have a disability or be extremely poor, whereas the Affordable Care Act made it available to anyone. I won't get into this too much, but part of the 2012 Supreme Court decision that upheld the Affordable Care Act struck down the Medicaid expansion portion of the Affordable Care Act. Not that there wasn't Medicaid expansion, but the Affordable Care Act made it mandatory, where states had to expand Medicaid or they would lose all Medicaid funding. And in 2012, the Supreme Court said, it has to be a choice. So as a result of that, not all states expanded Medicaid. They're sort of slowly coming into the fold, but there's still 12 states that haven't expanded Medicaid coverage. So like I said, I went through all the reports that GAO has done in the past 10 plus years on the Affordable Care Act, and tried to identify themes and things that stood out to me. And I identified 4 sort of general themes or topics. The first is what I call the pre-enactment phase. So this is, prior to the passage of the Affordable Care Act, the kind of work that GAO did, as Congress was debating the Affordable Care Act, the kind of how we analyze the sort of public coverage and private insurance market landscape. What was people's experience, what were coverage levels, what were people paying, et cetera, and also doing some initial work on, the sort of various ways to expand coverage and, approaches that Congress was considering as they were debating health reform. The next stage that I'll discuss a little bit is sort of the initial ACA transitional program. So the ACA was passed in 2010, but the bulk of the law wasn't implemented until 2014. So the health insurance exchanges didn't open until 2014. States didn't expand Medicaid until 2014. So there's this, 4-ish year period where, certain aspects of the law were being implemented, but not all. So I kind of made that its own sort of distinct period. And then the third sort of theme I identified as this initial implementation oversight, so the very early stages of ACA implementation. This was a really chaotic time where, healthcare.gov wasn't working at first. States were, implementing these very new programs, these very new contracting relationships with, the people, the states and the federal government were working with to kind of, set up these structures. And then, our more recent work that, was able to kind of start looking at, after we've had a few years of ACA implementation, what are some of the effects on, things like coverage, cost, and the availability of health insurance. So I'm going to kind of go through each one of these individually, not in super detail. Like if anyone's curious, I have a whole list of all the reports that I kind of pulled and looked at to kind of identify these themes. But I'll talk about some of the things that kind of jumped out to me that seemed important. And for each phase, I'll talk about public coverage, so Medicaid, Children's Health Insurance Program, separately from private insurance markets. So prior to the enactment of the Affordable Care Act, some of the public health coverage issues that GAO looked at was, one issue that came up a lot was this idea of crowd out. So this is something we started looking at, especially when the Children's Health Insurance Program was passed, which is what it sounds like, but it, in particular, the Children's Health Insurance Program covers children and families that make too much money to qualify for Medicaid, but don't make enough money to, afford private coverage on their own. So some of the things that especially Republicans in Congress were interested in is, do these public health coverage programs prevent people from otherwise signing up for private coverage, through their employer or through the private insurance market? So what they call crowd out. We also did a lot of research on Medicaid waivers, which would become pretty important in the debate about Medicaid expansion. I'll talk about in a little bit, but in short, states administer their own Medicaid programs, but they are subject to federal requirements, unlike Medicare, which is a totally federal program. So if you're a senior citizen on Medicare, everyone, regardless of what state you live in, it's the same program. Whereas if you're poor or disabled and you're on Medicaid, your relationship with that program is going to be very different depending on the state you're in. So states can apply for waivers from the federal government to do certain things with their Medicaid program that might not otherwise be allowed under federal law. And I'll talk about that a bit later. Another issue we've worked on is this issue of supplemental payments within Medicaid. This is something I've worked on quite a bit at GAO. Most Medicaid payments are based on, our two providers, based on services that Medicaid enrollees receive. So if I'm on Medicaid, I go to the doctor, Medicaid pays that doctor for the visit or, the surgery or whatever. But the Medicaid program also makes what are called supplemental payments to states or healthcare providers that aren't attached to individual beneficiaries. And this will kind of become more important as the ACA is implemented, but it's something that we were looking at prior to the ACA being enacted to kind of get a sense of what states were doing differently with the payments that they receive from Medicaid. And of course, we looked at rising costs, which is a big part of the impetus for the Affordable Care Act in the first place. Similar with private markets, we looked at rising costs, and we also looked at state high-risk insurance pools, which were basically programs that states created that were intended for the kinds of people that had had pre-existing conditions or, for whatever reason, high health insurance costs that insurance companies didn't want to cover. States would create programs specifically for those people who couldn't otherwise get insurance. So, prior to the enactment of the Affordable Care Act, we were looking at, states' experience with these programs because we were expecting a lot of people who didn't have access to private insurance previously to, start newly enrolling in coverage to the marketplaces. And we wanted to get a sense of, what kinds of services these people use, what issues these programs had in, managing these costs and, being able to continue running. So kind of trying to look at, some precursor programs that states were trying before the Affordable Care Act. So next is this sort of initial transitional programs under the ACA. So in the time between when the ACA was passed and when it was fully implemented. In terms of public coverage issues, we were looking at benefits and dynamics family coverage. By that, I mean, after the Children's Health Insurance Program was established, we found that, even though this program was intended for children, children and parents, the parents can't be on the Children's Health Insurance Program, but if a child was, the parent was much more likely to also have coverage, for a variety of reasons. They, in the act of enrolling their children in CHIP, they might, become aware that they're eligible for Medicaid or decide that, hey, I should have insurance too. So we found that as more children were getting health coverage, their parents also were, even though they weren't enrolled in the same coverage. We also looked at different kinds of Medicaid reimbursement formulas, again, CHIP implementation, the kind of services that were available to people in public coverage, so people who are enrolled in Medicaid and Children's Health Insurance Program, what kind of services they're getting, which speaks to both how the program is designed and whether people are able to access services, but also speaks to what are the needs of this population. Does this population need more behavioral health, mental health services, substance use treatment than the general population, et cetera. Again, to try to get both understand how these current programs are operating, but also to get a sense of once more people start enrolling in Medicaid in 2014, once more people start enrolling in private insurance markets in 2014, what services might we expect them to need. We were also looking at state implementation decisions. So again, like I talked about, states had the option of whether or not to expand Medicaid. States had the option of whether they were going to set up their own private health insurance exchange or if they're going to use the federal platform. So looking at state decisions there, and what some states started doing around this time was, states that had, Republican governors, Republican legislatures that were sort of hostile to the Affordable Care Act, or had, long-standing sort of antipathy towards, welfare programs and Medicaid in general. There was, a political incentive, I guess, to not participate, to not make their own insurance exchange, to not expand Medicaid because they didn't like the Affordable Care Act. But there's also, sort of countervailing pressures. It's better for state budgets if, people have health coverage. For the Medicaid expansion, the federal government was paying a higher percentage of costs than they were under traditional Medicaid or Medicaid prior to the Affordable Care Act. So states, were kind of losing out on money by not doing this. So there was some sort of countervailing pressures for states that were hostile to the ACA to expand Medicaid anyways. So what a lot of states, or not a lot of states, but a handful of, you know, red states, I guess, to kind of paint with a broad brush, would do is try to think of ways they can, you know, take a conservative approach or a market-based approach to expanding Medicaid. So for example, through Medicaid waivers. So they would apply for a waiver through the federal government to do something a little different. So one example is the state of Arkansas, which applied for a waiver to use Medicaid funding to enroll people in private insurance coverage. So using Medicaid money, but instead of enrolling people in Medicaid, they enroll people in private insurance coverage. Other states applied for other sorts of, you know, conservative tweaks to their programs. You know, a hot topic with Medicaid waivers right now is the idea of work requirements. So some states want, you know, as a condition of eligible people on these programs to either be working or looking for work a certain number of hours a week. Under the Obama administration, they said absolutely not. You know, they wouldn't approve waivers like that because they said it was, you know, sort of against the spirit of the Medicaid program. Administration green light for states to go. The issues kind of wrapped up in the courts right now, but you know, those, you know, ways that states were trying to expand Medicaid on their own term. And then for private insurance markets, you know, we looked at, you know, ways that states and insurance companies were trying to encourage voluntary enrollment. So again, until 2012, it was the state of the Affordable Care Act was tenuous in many ways. It kind of still is, but you know, until the Supreme Court upheld the Affordable Care Act, you know, people weren't sure if, you know, the whole thing's going to get struck down. Is the individual mandate going to be struck down? So even before that Supreme Court case, you know, GAO was looking at how people encourage enrollment when it's not mandatory. We're looking at the extent to which coverage was denied, premium rates, how states and insurance companies were implementing a requirement called the medical loss ratio, which under the Affordable Care Act, insurance companies have to spend at least 80% of their revenues on coverage, and they can't spend more than the remaining 20% on things like advertising and, you know, executive pay and that sort of thing. That was something that was implemented early on, so we're looking at that. We looked at contracting, so, you know, the states and the federal government had to set up these health insurance marketplaces, so they had to contract with, you know, IT companies, they had to contract with organizations, doing other organizations to help them do so. So we reported on that kind of work. Again, reporting on crowd out, levels of employer-sponsored coverage, state implementations of marketplaces. So the next phase is sort of initial implementation and oversight of the Affordable Care Act in the first few years of once it was fully implemented. So in terms of public coverage, we were looking at, you know, costs for people enrolled in Medicaid, whether they're able to look at the waivers I talked about, how much they cost to administer, how the government decided whether or not they were going to approve these waivers. One of the first reports that I worked on at GAO was access to behavioral health services. So again, in states that expand Medicaid, people that hadn't had health insurance coverage previously are now eligible for it and are, you know, enrolling for the first time or the first time in a while. And so we didn't have a sense of what, you know, what services they would need, you know, sort of what medical conditions they had. So one of the first reports I worked on is we took a handful of states and, you know, collected a lot of data on people who were newly enrolled in Medicaid, you know, what services they were using, what drugs they were being prescribed. And to do that, we had to access a lot of different sources of data. We used certainly state and federal Medicaid data, but there's a lot of problems with both those. So we also had to buy data from other companies that, you know, track, you know, how much, you know, what kinds of prescription drugs are prescribed, et cetera. So, you know, we reported on, what this newly enrolled population, what kind of services they were using, and what health conditions they had. We looked at how public coverage programs like Medicaid were interacting with the private insurance marketplaces. One of the ideas of the ACA was that these insurance marketplaces would kind of be a one-stop shop for consumers or citizens. That you could go to the state or federal marketplace, and if you are make enough money to qualify for health insurance subsidies, you could get them there. But if if your income was low enough that you could qualify for Medicaid, you could also enroll in Medicaid through there. So these same sort of IT systems, need to be able to communicate not only with your tax and income data, but also state Medicaid offices to kind of coordinate enrollment through the same place. And on the private market side, we certainly looked at year over year, how many people are being enrolled, what is their access to care. We did a lot of work on the sort of federal data hub that these marketplaces would kind of ping to get information on people who are trying to enroll. Contract management, this is a big deal. People might remember when the marketplaces first opened, it was chaos, it didn't work. I think on the first day that the federal marketplace was available, I think a total of 6 people were able to enroll. They're expecting thousands and thousands of people to enroll all at once, and it crashed the system. They weren't ready for it for a variety of reasons, and so there are these massive problems. And so as the sort of Congressional watchdog oversight agency, we did a lot of reporting on the reasons for that. What were the management decisions made at HHS that led to this? What were the contracting relationships like between HHS and the companies they contracted with? And what were their sort of internal controls, and kind of what led to this happening? I don't think I talked about it much in when I was going through the different mission teams at GAO, but one of the mission teams is, I think it's called the forensic audit team, and they do a lot of undercover work. So they would kind of create accounts, basically see how far they can get through the marketplaces, using fake names and fake identities, kind of looking at how robust are the sort of processes that these systems use to check people's identities and that sort of thing. So a lot of work in that regard. Reasons for low initial enrollment. We also looked at things like, how is the insurance market changing under this sort of new paradigm? And what we've been finding is that there's been more insurance market concentration. So generally fewer insurance companies operating in state markets, and sort of consolidating in that regard. So that was one of some of the findings. And then finally, in the sort of more current period, now that we've had a few years of implementation of the Affordable Care Act, what are some conclusions we're able to draw on, some trends that we're seeing in terms of coverage? So for public coverage, again, still looking at things like access to care. And when you look at the list of reports that we've done on this, and sometimes you'll see something and there's only one report on this subject, or maybe a few reports on different facets of a general topic area. But in other cases, we'll do, basically the same exact report, just with, updated information. So it's been 6 months, it's been a year since our last one. How are premiums and costs changing year over year? How is enrollment changing year over year? So, in addition to sort of one-off or reports on specific issues, we also kind of do some reporting on some recurring things as well, and kind of have developed a body of work in that regard. Again, still, Medicaid waivers are still a very hot topic, still something that's states are very involved with, something that's a hot topic both at the federal level in terms of what HHS will and won't approve, and since the Trump administration has been more willing to approve things like these issues are low. And on the private side, early satisfaction, now that people have this coverage, how satisfied are they with it in terms of cost and, the services they're able to get from their providers, what plan options are available to people. And this is something that kind of goes both ways. On the one hand, you might think, okay, the more options, the better, gives people different choices. On the other hand, one thing the Affordable Care Act tried to do is kind of simplify the options available to people. So the Affordable Care Act has, what they call the metal tiers. There's gold, silver, or platinum, gold, silver, and bronze plans that cover, have different levels of coverage, cover different things, and try to simplify for people, as opposed to, I don't know how many of you have ever had an, open enrollment period, had the opportunity to, change health insurance, looking at different plans. It's very, very confusing. I do this for a living, and whenever, my employer does open enrollment and I look at the options, I kind of just, my eyes glaze over. I don't really know what to do. So we look at, plan options kind of in both ways. Like, do people have enough choices to cover the things they need covered? At the same time, what is the enrollee experience with the choices they have? And is it confusing for people? Do people have a hard time picking plans and that sort of thing? The enrollment and re-enrollment process, what is the, we look at, what is the enrollee experience? Is it, is changing plans from year to year easy? What are states doing in terms of they automatically re-enrolling people in a plan? If they don't take any action, do people have to take action themselves to be re-enrolled? That sort of things, costs, ensure participation, and plan design. Before I move on from this, I want to talk about a sort of illustrative example of a report that I find really interesting, both on its merits in terms of, the sort of issues it speaks to, but I also think it's a good example of the kind of work GAO does and how we talk about things. So in 2018, we put out a report called Health Insurance Exchanges, HHS Should Enhance Its Management of Open Enrollment Performance. And this report was based on a request that we received from Congress from and I apologize, I have to change rooms to accommodate nap time. So I'm going to kind of speak as I'm wandering through my own house. Hey, buddy, how you doing? I'm going to go downstairs, okay? Sorry, my office is adjacent to my son's bedroom, so here I am. And the reason we started doing this work was because we had a request from Congress regarding decisions that the Trump administration had made in its implementation of the Affordable Care Act. So, to kind of set the context that, it wasn't that long ago, so I'm sure we all have a sense of this, but, Trump administration campaigned on repealing and replacing the Affordable Care Act. The administration and Republicans in Congress were generally hostile to the ACA. We talked about the challenges in the Supreme Court, states not expanding Medicaid, states not setting up their own health insurance exchanges. So there's a lot of questions about, is the Trump administration going to continue implementing the Affordable Care Act in good faith? Are they going to sabotage it? What's going to happen? And, when they, took over, they made a lot of changes to how they implement the Affordable Care Act. They cut the budget for marketing and advertising the Affordable Care Act by 90%. They reduced the open enrollment period. It was 3 months where you had to enroll in coverage or change plans. They reduced it to a month. They reduced funding for what are called navigator organizations that help try to enroll people during the open enrollment period, help provide assistance to people in deciding what plan to enroll in and that sort of thing. So kind of across the board, the administration made a lot of changes to how the ACA was implemented relative, in comparison with how the Obama administration was doing it, that inspired members of Congress to make a request of GAO to, to kind of look into this and report on it. And so I was not an analyst in this report, but I was interviewed based on the work I had done prior to coming to GAO and, sort of my, my knowledge of, the sort of organizations involved, and not only to direct them to who else to interview, but, to kind of help with like the lay of the land in terms of what kinds of groups are involved in helping people get enrolled in coverage. And so, like I said, it takes GAO a while to do reports. So, we released this report about a year after the Trump administration made these changes. So we were able to talk about the effects of these changes in the context of how enrollment changed. And I like highlighting this example for a couple of reasons. One is that we had some pretty unexpected and I think really interesting findings. And I also think it's a really good example of how we talk about things. So the top level finding is that between 2017, the first year of the Trump administration, when they implemented these changes to the Affordable Care Act in 2018, we saw a 5% decline in enrollment in the federal marketplace. And, if you're inclined to think that more, it's good if people are covered, this is not good news for a few reasons. One, it suggests there's more people who are uninsured, but two, part of the idea with how enrollment would work under the Affordable Care Act is that, we certainly expected an initial, a very high level of interest in the ACA among people who didn't have coverage before, that they would all want to enroll, as soon as coverage became available, which was, was more or less the case. Like I said, crashed the system early on. But we also expected that, we'd have this initial huge wave of people being insured, but then also that each year that should also increase a little bit each year. Oftentimes, politicians, especially Democrats, will talk about the ACA as, providing universal coverage, but that's not really true, right? There are still people who were uninsured even after the Affordable Care Act was implemented, for a variety of reasons. They might not be aware that there's financial assistance to enroll. They might think it's still unaffordable even with financial assistance. They might not understand how these systems work. I mean, they are very complicated. So there's a lot of reasons why people might still not be enrolled in coverage even after the Affordable Care Act has been fully implemented. So in addition to this sort of initial, large increase in the number of people who enrolled when it was first implemented, we also expected that there would be, increases over the next few years as well as, the marketplaces became more mature, as states and the federal government got better at sort of implementing the marketplaces, got better at, reaching hard to reach consumers who aren't enrolled, et cetera. So for there to be a decline from 2017 to 2018, suggests something's going on. The market shouldn't be so saturated that people, fewer people are enrolling. On the other hand, given a 90% decrease in advertising, reduced funding for navigators, open enrollment reduced by 2/3, it's almost a pleasant surprise that it only decreased by 5%. So on the one hand, it is troubling. On the other hand, it's also kind of head scratching that it didn't decrease that much. And GAO found a few reasons for this. A bullet I forgot to include in the previous pages. Another reason why we'd expect enrollment to decline is that the Department of Health and Human Services stopped making payments to insurers that reduce costs for insurers. So the Affordable Care Act tried to reduce costs for consumers in two ways. One is by providing subsidies for people to pay their premiums, but also paying insurers to cover costs for consumers' out-of-pocket costs in addition to premiums. So the copay when you go to the doctor, co-insurance payments, your deductible, and under the ACA, if you enroll in a certain kind of plan called a silver plan, you don't have to make those payments. And the federal government was making payments directly to insurance companies to kind of offset those costs. But the Trump administration stopped making those payments. So another reason why we might have expected there to be fewer people enrolled, because there's an expectation that insurance companies would pass these costs on to consumers, and fewer people would enroll. But we found a couple things. One is we discovered that insurance companies, and kind of coordinated by state insurance commissioners, were doing something that we called silver loading, which is they were increasing premiums on silver plans, with the rationale being that because those increases in premiums are offset by subsidies from the federal government, like on a literal one-to-one basis, if an insurance company increases the premium of the silver level plan by 20%, the federal government, if you qualify for, if your income is in the right range, will increase subsidies by 20%. So what state insurance commissioners were telling insurance companies to do was to basically take the money you're losing from the government not sending you these cost sharing, this money for cost sharing, take that and just apply it to the cost of premiums for a silver plan. Because from a consumer's perspective, it's a wash, right? The cost is going up, but the cost is going up for the federal government, not for you, because the federal government is giving you subsidies to purchase it. Now, if you make too much money to receive subsidies from the federal government, and you still, for whatever reason, need to get coverage from the marketplaces, you're out of luck. But for most people who were getting subsidies from the federal government, these costs were sort of offset by this sort of accounting trick that states and insurance companies discovered they could do to kind of make this this action the Trump administration take, kind of make it a wash, right? They reduced payments on the one hand, but they made up for them through premium subsidies on the other hand. So that was a really interesting finding that sort of was able to explain why, even though coverage levels decreased, they didn't decrease as much as you'd expect given the changes the Trump administration made. So that was an unexpected finding that the team that worked on that really took a while to kind of figure out what was going on, and to kind of like be able to kind of name and identify how is this working? Why aren't more people choosing not to be covered? But nonetheless, coverage did decline, and the reasons for this were sort of the obvious ones I already talked about. But I want to highlight how we talked about them, how we characterized these things. And I apologize. I dislike slides with a ton of text, but I did want to capture our exact words because I had a sort of a funny experience when I was reading this report when it came out. Because like I said, I was kind of involved in it. I was interviewed for it. I knew some people working on it, so I kind of and as a person who cares about health reform, who cares about coverage, I was very interested in what we were going to say about what the Trump administration was doing, and how we're going to characterize it. And I found myself laughing as I read it, because I think if I was reading this report before I worked at GAO, I think I would have found it to be pretty weak, kind of pulling its punches and not really getting at the heart of the issue, which is, speaking not as someone who works at GAO, but speaking as a citizen, not accurately describing the way in which the Trump administration was sabotaging the Affordable Care Act. But I didn't read this report before I worked at GAO. I read it as an employee, and I read it as someone who understands the process that I talked about earlier, who understands how hard it is to say anything and how, everything we say has to be, every word of every sentence has to have support and is going to go through multiple levels of review by a frankly risk-averse agency. And so I actually kind of read this report as an employee as to be very hard-hitting, but I kind of want to talk about, these examples of how we talked about it. So, we interviewed a lot of people about how, what might cause the change in enrollment, the decline in enrollment from year to year. And we say stakeholders had mixed opinions on the effects, which just means, we talked to people who characterize it differently. So we talked to people who work at liberal think tanks. We talked to people who worked at, conservative think tanks. And, that's sort of how we report differences of opinion. We talked about how HHS, then we talked about our findings by, how the Department of Health and Human Services under the Trump administration justified these decisions I talked about earlier, how they justified, reducing advertising by 90%, how they justified reducing funding for navigators, and what their processes were. And so we talk about how HHS allocated funding using data acknowledged were not reliable. The lack of quality data may affect HHS's ability to effectively manage the navigator program. And again, that might sound kind of boring how it's worded, but that is in GAO world, that is a super hard-hitting statement. We are saying that basically they're not basing their opinions on data at all. They're just kind of doing whatever they want without regard to how it's going to affect the programs that they're responsible for administering. We then go on to say, unlike prior years, HHS did not set any numeric targets related to 2018 total healthcare.gov enrollment. Officials told us they instead focused on enhancing the consumer experience for the open enrollment period. And then we go on to politely suggest that setting numeric targets would allow HHS to monitor and evaluate its overall performance, a key aspect of federal internal controls. Again, if I read this before I came to GAO, I'd be like, what is this nonsense? They're not saying anything. But as GAO employee, I can tell you this is strong. This is a strongly worded statement. We're saying that they are doing things without regard to the effects they'll have, and basically, doing things kind of on a whim almost, sort of based on their ideological disposition towards the Affordable Care Act. Again, speaking for myself here. And we go on to say, okay, so HHS told us that, they were focused less on total enrollment as a metric and more focused on things like consumer experience, but nonetheless, while they reported their goal was to enhance the consumer experience, such as improving healthcare.gov availability, they weren't measuring aspects of the consumer experience that they had identified as the main reason they're doing this. So basically, again, what we're saying here is that their rationale for these decisions is total BS because they're not bothering to measure the things that they purport to care about. So, that's just an example of, I think a really interesting example. I think it's a really interesting report in and of itself because, it was at the time a very hot topic with regard to the changes the Trump administration was making with regard to how it implemented the ACA relative to the Obama administration. Had some of these, sort of unexpected finding, this sort of novel kind of accounting concept that insurance companies were using to kind of basically adapt to this new landscape of ACA implementation under the Trump administration. And then, like I said, just really interesting examples of, how we talk about things at GAO and the sort of language we use. And, even when we're talking about something that is a really hot topic, we use very measured language, and you almost kind of have to read between the lines to kind of, get at, what the main takeaway is. And so finally, I want to talk just a bit about work that GAO is doing to provide oversight for the CARES Act, which was recently passed as the Coronavirus Aid, Relief, and Economic Security Act. It was the $2 trillion appropriated for, to help people, not only help address the coronavirus itself, to providing funding for, things like personal protective equipment, contact tracing, et cetera, but also to, sort of triage the, economic consequences of, everything that's been happening from, state lockdowns, et cetera. So part of, within the law itself, in addition to, providing things like, $1,200 direct checks to people, trying to help businesses keep people employed through the payment protection program, et cetera, that also contain a mandate for GAO to study CARES Act spending. And this is the way we were tasked with doing this work is a little different for GAO in that it's much more real-time reporting. Like I said, usually we get a request from Congress and we get back to them 10, 12 months later. For the CARES Act, Congress wanted a report within the first 90 days, and then, sorry, there's a typo here, a report every 60 days after that, which is a very different from how we normally go about our work. Involves really processing data as it's coming in with the case of our first CARES Act report, before even the federal government was releasing some of this information, we were getting information directly from agencies and reporting it before they were even reporting it themselves. So here's an example of a graphic that came from our reports, just kind of providing a visual of how that CARES Act funding was allocated to the different parts. Most of it went to Small Business Administration for the Paycheck Protection Program. Another big chunk went to individuals, either through direct, the direct $1,200 checks or enhanced unemployment insurance, et cetera. We are also tasked with providing oversight over Operation Warp Speed, which is the administration's program to, as quickly as possible, develop a vaccine. And for that, we have briefings every 2 weeks with Congress, whereas normally in the course of a year-long report, we might brief Congress once or twice. So it's a very different reporting posture for GAO, much faster turnaround, much more interaction with Congress. And it's taken quite a bit of resources from the agency to kind of pull it off and make it happen. A lot of other work has been kind of put on hold, or it's taking longer because so much of our efforts have been devoted to CARES Act reporting. And I'll just talk about some of our key findings. We've reported on shortages in personal protective equipment and testing supplies across the country. We've talked about how a reason for this is most of these supplies aren't made in the United States; they're made elsewhere, and there's kind of I think you probably heard a lot in the news about demand or competition among states to try to get this equipment, but there's also competition among countries, which makes it hard. We reported on how HHS is collecting and reporting data on COVID-19 cases, hospitalizations, et cetera. We've reported on one of the things we reported on that made a lot of news was, how much of those, $1,200 checks went to people who were deceased or otherwise ineligible. And we made recommendations to the Department of Treasury and IRS about how to, improve their data systems and, have a sense of who was eligible to be receiving these payments. Made additional recommendations to Small Business Administration, IRS, and Labor about Paycheck Protection Program. And we've suggested additional matters for Congress regarding things like aviation preparedness, how the airline industry is coping with the reduced demand, how they're, implementing programs to, social distance, keep people safe, and that sort of thing. So again, didn't go into as much detail on that, A, because it's kind of a moving target, B, it's so recent, but, I think it's a really interesting aspect of not only what the country is going through right now and how it's addressing the crisis, but how GAO is doing this work and how different it is from, the sort of what I spent a lot of today describing so far. So I will leave it there, but I'm looking forward to talking through any questions or discussing any of these things.
Great. Thank you so much, Sean. So you guys, if you have a question, feel free to unmute and just shout it out. Anybody? I can get us started. Oh yeah, go ahead, please.
I guess, do you find this like jobs, certain projects hard to come like with an unbiased opinion on studying these issues?
Yeah, that's a really good question. I mean, the answer is basically no, for a lot of different reasons. One is that you kind of, there's some self-selection that happens, right? Like, this is not a place to be if you have, really strong opinions and want to be publishing work that, if you have like, an agenda that you want to get out there, if you had that, you wouldn't come to work for GAO, you'd go to work for a think tank or an advocacy organization, right? So it's sort of self-selection. I talked about before how I've worked in different think tanks and different sort of academic environments that had not a bias, but certain points of view, certain areas of focus. And one of the reasons I wanted to go to GAO in the first place is because I wanted to, I was looking at my list of publications and I didn't want it to just be like, I didn't want to become the guy who like is always talking about why Medicaid expansion is so great. You know what I mean? I wanted to have experience and have publications under my name that, were more objective and nonpartisan and, have that experience because, I found that when I've been doing research in the various settings where I've done it, whether it's, as a graduate student at Syracuse University, whether it's, as a research fellow at Georgetown. I also was an analyst at the Center on Budget and Policy Priorities, which is like a liberal think tank in Washington. As I'd be doing, working on a research project and, trying to, get up to speed and see what's out there, if I found stuff that was done by, various think tanks that was useful, okay, great. But, you kind of see who's putting it out and, decide how you want to caveat it either in your writing or in your own head. But, if I came upon a GAO report or a CRS report, I knew like, okay, like if I came upon one of those reports, like on the thing I want to talk about, it was like, I was very excited because I knew this is like really reliable and it's something that I could point to without someone being like, well, that's, it's from a liberal think tank or it's from a conservative think tank or whatever. So it was like through doing work other places and encountering GAO reports as part of that work that kind of got me interested in the first place. So there's that. So there's some self-selection. That was, a long response to that. But then there's also, I spent some time earlier talking about our process and, it's, even if like, you wanted to, it's really hard. It would be it's a tall order to try to sneak in any bias in there just because of we don't dictate the questions we ask, we take requests from Congress and, often those requests can have, bias in them and we kind of like, change the wording of questions and that sort of thing to make them more objective and nonpartisan. So like from the very start of, when we start a new project, we, kind of, we'll try to take, I'm not saying we would get a question worded this way, but if we got a question from a Democratic senator that's like, tell us about how the Trump administration is sabotaging the Affordable Care Act, we're not going to put that question in a report. The question is going to be, describe the ways in which the Trump administration is, making decisions regarding its implementation of the Affordable Care Act, right? So we kind of, at the very outset, kind of try to strip that stuff away. And then, like I said, we, have a really robust review process and, very high standards for the evidence we use. And, if we're attributing something, information or a perspective to to someone, we, say where it's coming from. If it's GAO saying something, we really have to, a lot goes into justifying that. And something I meant to talk about before that I skipped over is that, GAO reports are kind of, it's corporate authorship, right? So, you wouldn't pick up a GAO report and it wouldn't say like, such and such topic written by Sean Miskell. Our reports are all by GAO. We speak with one voice in all our work. Whenever we're working on a report, we always, even internally, we'll always say, we say this, we say that. A reviewer can come in at the very end of the process and we'll say like, as we're talking about, say we say this here, we say that there. Everyone kind of, the report is owned by everyone. There's no like primary author, even if there might be one in practice. That's not how it's. That's not how we put things out there. Everything is, something that's said by GAO, not by the individuals working on it. So I think I'll kind of leave it there. But I guess sort of in summary, that the answer is no, because it's unlikely that people would want to be doing that work here. It's not. I don't think it would attract that kind of interest, but also there's just so many steps to the process, so many levels of review, and the standards to be able to say anything are very high. And it's hard to picture someone getting something biased out the door.
Thank you.
Yeah, it's a great question.
Sean, I know one of the things, oh, Alexandra, did you have a question?
Yeah.
Go ahead.
I had two questions. The first one was, does the GAO always get to finish every report it starts, or is there ever a point like halfway through the writing process where like lack of funding or something forces the office to have to shut down or shelve a particular report? And my second question is, can you think of an example where the GAO had like a decisive impact on a particular policy or legislation by like changing legislators' mind or showing some sort of piece of research that wasn't in the debate before?
Yeah, those are both really good questions. So in terms of the first one, like we put out hundreds of reports a year. So, I don't want to say like too definitively, but I think the answer to that first question is generally no. Not because, things like resources and budget are an issue. For example, at this very moment, we don't actually have a budget for the federal government because we're operating under a continuing resolution, which, entails a lot of uncertainty for us. And, there are other circumstances that, might kind of, make a report tenuous. So for example, I talked about before how, I worked on a report on behavioral health utilization after the ACA was implemented. And in the middle of working on that report, we had the 2016 election. And after, President Trump won the election, we got together as a team and, talked about, what changes we should make, if any, because we're talking about, we're talking about Medicaid expansion, and at the time it looked like the Affordable Care Act was going to be repealed, and there wouldn't be any more Medicaid expansion. So we, had to talk through what that meant for us. But it's not. I think it's not so much that we would stop working on a report and it just move on and it kind of goes into the dustbin, but more that we would change how we were doing that work. So for the example I just talked about with Medicaid expansion and behavioral health utilization, we made some changes to try to get it out more quickly so it would still be relevant, and ended up being a moot point anyways because the ACA wasn't struck down. It wasn't repealed. But in other cases, they might change the scope and methodology, to accommodate, whatever happened, like you said, if there's a budgetary issue. So, a team might have planned to do site visits around the country that, if there's an issue with budgets, they might scrap those and, do them, virtually, or just, change the methodology so that's not part of it, and they would get a different kind of source of information elsewhere. And so yeah, I think that's more likely what we would do, is that we would change how we're doing it, and so we could still answer the questions, using different information, or we would scope the questions differently, so maybe it's more narrow and we're able to do it with the resources we have. And I would say, and if for some reason, whether it's budgets or different circumstances, that we would not release a report, we would still do something, whether it's, we would at least brief Congress on the work that we did do. So we would never stop something and just, walk away. Even if we decide not, for whatever reason, we aren't going to release a report publicly, which we wouldn't normally do anyways. We would try to find a way to get it out there different ways, but if we did, we would at least have a briefing with the requesters and pass on the information that we did have. So we would always just try to close it out in that regard. No matter what, we would just walk away from the topic. That's a great question. And your second question about impacts we've had, it's a good one. Some of the really high profile things would be some of the legal decisions we had. One that gets talked about a lot around the agency is, I think in 2005, we were doing work on the Bush administration's energy policy, and there was a situation where Vice President Cheney was, kind of having these meetings with various stakeholders in the energy industry that, they weren't releasing information from those meetings and sort of how decisions were being made. And GAO engaged in a very protracted, legal process with the administration to get that information, and was eventually successful. And that's something they come back to a lot, that was in the news a lot. But other examples, I think it's like I said, if we have a recommendation, the agency is really supposed to implement it. And, in a lot of cases, I don't think they're getting at things that you're asking about, but, because they're more sort of nitty-gritty minutia of how these programs are run, things that wouldn't necessarily make headlines, but do change the way agencies do things or do save money. A lot of the sort of, big ticket items that kind of feed into the statistic I mentioned before, where, every dollar invested in GAO generates over $300 in savings, is usually related to the big ticket programs like Medicare or Medicaid. We could suggest, make a recommendation that, agencies make tweaks in what they're doing that might seem kind of arcane and not very newsworthy, but might result in billions of dollars of savings or whatever. So, I'm probably not doing the best job of answering that question, because I'm I don't have GAO compiles all that, implemented recommendations and stuff into accomplishment reports I don't have in front of me. But we do track that sort of thing. How many of our recommendations are implemented, cost savings and that sort of thing. I think newsworthy things are probably fewer and far between, and are probably more related to our legal opinions. And, the sort of, changes at the agency level and cost savings are usually probably the result of smaller scale, narrow recommendations, but sort of in aggregate, amount to a lot. Hope that's helpful.
Thank you.
Yeah, those are great questions.
Sean, for people that are interested in this kind of career, whether or not specifically a GAO or just sort of civil servant, in DC, you mentioned some of the things that you've done on your way to working for the GAO, but can you give students a sense for what might be helpful for them to do in terms of what to study, or, internships or grad school, or just any kind of career path advice?
Yeah, that's a really good question. So I think see where to start. So I think I'll start like specifically for like this kind of job. So for a job at GAO or a job with, you know, the federal government in general, you know, an agency or another oversight body, you'd have to apply through USA Jobs. You know, it's not the kind of thing where, you know, like you can like know someone somewhere and they can get you in. Like everyone has to go through the same sort of portal. You know, so that you know, any federal jobs available would be, you know, posted through there. You know, they're open for a certain amount of time. You know, everyone has to provide the same information. And, you know, the point of that is, you know, to try to make it fair. But it's also, you know, sort of a problematic process because you really kind of have to know how to navigate those systems. Because, you know, when you apply for a federal job, you know, it's not like my boss at GAO that, you know, I work with on these reports is reading these applications that come in. It's, you know, it's an HR professional, you know, and kind of like an administrative assistant that's going through them first and, you know, trying to provide a smaller pool of applications for the, you know, for then the people at the agency who would then be reading them and doing the interviews and then hiring people. And so, you know, one really important thing is if you are applying for a federal job and going through, you know, the USA Jobs website, you know, you'll have to upload your resume and there'll be questions you have to answer about the job. And you have to use language in the position description for it to make it through the process. You know, you can't, it's not the kind of thing where like you want to engage in like creative writing and, you know, oh, the position description says this, but, you know, it's going to sound lame if I like use those exact same words. So I'll try to tweak them and, you know, sound more artful or whatever. Like you almost have to very rotely like kind of parrot back what the qualifications are. And, you know, so, you know, what sort of, you know, they call them KSAs, knowledge, skills, and abilities that will be listed in the position description. You know, there'll be like a bulleted list of like, you know, what duties the position you're expected to perform the position. And like in your resume, in your answer to those questions, you want to just say all those things, you know, obviously, truthfully, right? You know, if you didn't, you know, if your experience doesn't support that, you shouldn't make it up. But like, if you have done anything, an internship, in a class, whatever, that, you know, matches up with, you know, what's in the position description, you want to say that and you want to say in the exact same words that they say in the position description. Another thing that's different about the federal hiring process is, you know, if you're applying, you know, for a job with a private company or a different kind of organization, you know, you probably spend a lot of time formatting your resume, getting it down to a page, maybe 2 pages, you know, not, you know, being concise and that sort of thing. Whereas like, if you're applying for a federal job, like your resume cannot be too long and the incentive is to put as much stuff in there as possible, regardless of how long it is. You know, you're going to put stuff in the system and it's probably going to look like really like janky when it's printed out because it's going to be long. And like I said, you know, if you're using the language from the position description, is going to seem inartful looking, but for the federal government, that's kind of what you have to do to make it through the process, because there's going to be people who are screening your applications. They're going to be looking for people who use like this exact language. So that's really important. And I don't think it's widely known. And, you know, I'm sure a lot of people, otherwise qualified people, probably don't get a chance because they might not understand, like, that's kind of how you have to navigate the system. And, you know, sort of related to that is, you know, I mean, there are certainly entry-level positions, but, you know, when you are, you know, that people expect to be filled with people who are getting out of college or getting out of grad school. But when you're filling out your application and when you're interviewing for a position, the question, you know, the process is often a very structured interview process where they ask the same questions of all the candidates. And the questions are going to be based on your experience, on things you've done. So it's not about, your knowledge of a certain topic area or your knowledge of an agency and having a good sense of what's going on, or, obviously, it helps to be a good student, have good grades, et cetera. But, I'm sure they consider those things as they're screening applications. But what if you make it to to the stage where you're being interviewed, the questions they ask you are going to be about things you've done. And so in that context, having opportunity, seeking out opportunities to be able to speak to those questions is really important. So, I would, encourage people to pursue internships, other kinds of activities, whether it's presenting work you've done at a class at a conference, or that sort of thing that gives you sort of concrete examples that you can say you've done that are different than I took a class on the federal budgeting process. That's helpful and it's important, but it's a lot better if you can say I took this class, and even if it's not an internship, if it's not a job you've had, if it's not a conference you went to, even you even want to talk about your educational experience in ways that speak to concrete experience. So in this class, I composed this report on this topic and I presented my findings to the class and this and that, kind of emphasizing the not just the content of what you've done, but sort of emphasizing the verbs, like the things you've done, even if it's in the context of school. I think is really important because they're looking for you to speak to your experience, not just your knowledge. And lastly, this sort of maybe kind of cuts in the opposite way of what I was saying about for the federal government, it's a the sort of centralized process, and it's meant to be objective. It also always helps to talk to as many people as possible. So I'm happy to share my email, my contact information with Professor Boscarino, and happy to speak to any of you. If any of you were to speak to me or someone like me, in addition to asking questions of me or someone like me, you should also ask that person, who else do you know that I should speak to? Who else can you put me in contact with that I could also, I think, it sounds kind of trite, but it is networking is really important, both in terms of, knowing people that work in different places and be able to get, advice like I was sharing about here, hey, here's how you navigate the USA Jobs portal. But also, sometimes even just being aware of what positions are out there. Sometimes a position will open it at GAO and they'll only leave it open for a week. And, if you miss that they announced that position or whatever, you missed it, right? So it helps to kind of know people in different places and to kind of be aware of what positions are becoming available. And, for positions outside the federal government, it's really important to know as many people as possible and have people who can speak for you, whether it's in the form of formal references or even just, it's often a small world in public policy, especially if you're interested in a certain area, if you're interested in health policy or environmental policy, it's often everyone in that area kind of knows each other. And another thing I will say in general, and this is similar to what I was saying about the applying for the federal government USA jobs, is that the idea of when people are hiring, they're certainly looking for people who are qualified, but it's not the person who went to the best school with the best grades is automatically gonna get the job. Often it's, people think about more diffuse concepts like who is a good fit. And so it's really important to, it's a lot of work to, tailor your resume and tailor your cover letter to the position you're applying for, as opposed to having, a general resume and general cover that you kind of tweak a little bit for each thing. Because it's not just about, who you are on paper and that you went to a good school or took the right classes or something. It's some more sort of squishy ideas. They're going to get a stack of applications of people with similar qualifications. It's great that you took a methodology class in college. It's great that you learned statistics, but the people who didn't aren't going to apply for that job anyways. And so everyone who's applying for that job also took those same classes. And so you want to make sure you're tailoring your materials in a way that like speaks to that specific position. It's going to make the people hiring think that you're a good fit for the organization and that job.
Great, thank you. Okay, so we're coming up on 3 o'clock. So I know we have one last question, and Natalie wants to pose it. So Natalie, I'll let you unmute and ask your question.
Hi. So I know that you mentioned the GAO is nonpartisan, but I just was wondering if there's any issues like such as abortion, which is like very controversial, which like the GAO may like shy away from because of this like level of controversy.
That's a great question. I mean, the straightforward answer is no. And we've done reporting on in the context of the Affordable Care Act, specifically about abortion coverage and access to abortion services. And so the answer to your question is no, but at the same time, we tread delicately when we do that kind of work. Excuse me, I'm sorry. And I think, like I said, like I said in the beginning, we endeavor to be useful to folks on the Hill, and being useful means reporting on hot topic issues. But like I said, we'll tread lightly. We'll make sure we phrase our research questions in ways that are objective. We'll make sure we're really careful with how we report on things, and that we can justify what we're reporting on. And we would do that for anything, but certainly, especially for hot topics. And, we would just be really careful about how we went about it. We get training every year, and we have to fill out, disclosures about, conflict of interest, and we're not supposed to engage in certain activities. So to answer your question, to get back to your question, like, if we're writing a report on, something like abortion coverage, or access to abortion services, if I've spent my time away from work, going to like NARAL rallies, I'm probably not going to get staffed on that job, right, on that report. So we're very careful about, who is, if you don't think that, if you personally or the agency doesn't think that you can report on something in an objective way, like you're not going to be tasked with doing that work. So it's something that we take really seriously, but in terms of how we report on it, but I don't think we would shy away from something if it's just because it's a hot topic issue. We'd just be very careful on how we did so.
Thank you.
That's a great question too.
Great. Well, you guys, please join me in thanking Sean for this wonderful talk. I think we all learned a lot. Even I thought I understood the GAO, and now I'm realizing I had barely scraped the surface. So thank you, Sean, so much for giving us some insight into your agency, and then specifically on the healthcare policy side of things. You guys, I think Sean wouldn't mind me saying that if you have any other questions that we didn't have time to get to today, and you want to send them to me so that I can send them on to Sean, and then he can send us back his response. I think am I correct in saying you'd be okay with that, Sean?
Yeah, absolutely. And like I said, Professor Bascarino, if anyone has other questions in addition to what we talked about here, you absolutely feel free to share. I know you have my email. I'm very happy to speak with anyone about this stuff. Working in public policy research in general. Very happy to be a resource. I think it's like really important to, like I said, I've had a lot of help in being able to do this work, and I'm very happy to pay it forward. So if anyone has any questions, I'm happy to please feel free to get in touch.
Well, thank you. All right. That's so generous of you. Okay. Well, guys, thanks for coming. Go out there and enjoy that beautiful weather on this Saturday. And hopefully I'll be seeing all of you in person soon. Bye.
Thank you.
All right. Stay
Thank
safe.
you.
Stay safe, everyone.
Thank
Thanks
you.
very much.
Thank you.
Thank you very much.
Yeah.
Thank you.